day everyone. So for today, I'll be discussing with you the criteria for extubation. So when we talk about criteria, it's a matter of a yes or a no. So before we proceed on one procedure or before we do anything, we should meet all the criteria first. While when we talk about extubation, it simply means the removal of the endotracheal tube, or let's say it's the final step of liberating the patient from mechanical ventilation. So in the hospital, we have forms that we are using. So this is the respiratory therapy monitoring sheet or the respiratory progress sheet. So wherein we can find the criteria for extubation. So the criteria are here. We have 12 criteria, but to make it easier, I made a group for this. I made two groups so that it will be easier to understand. So the first group is the hemodynamically stability of the patient. So how can we say that the patient is hemodynamically stable? It's through the low or stop inotropes, and the other one is the hemoglobin should be greater than 8. And the next group will be the adequate ventilation and oxygenation. So we have here the PF ratio greater than 200. PF ratio means the arterial oxygen partial pressure to fractional oxygen, while the FiO2 should be less than 40, or the FiO2 means the fraction of inspired oxygen, while the PIP should be 5 or less than 5. PIP stands for the positive end expiratory pressure, and the RSBI, which means the rapid shallow breathing index, should be less than 105. And the SBT, which stands for spontaneous breathing trial, should be greater than 30 to 120 minutes. And then I just added the ABG, which stands for the arterial blood gas, because usually before every extubation, we have to take the ABG. And this is important as well because we have to compute for the PF ratio, and it will come from the ABG. So just to show you the computation on how to get the PF ratio, so it is computed by PaO2 divided by the FiO2, while the RSBI is computed by the respiratory rate divided by the tidal volume. So just to show you this form, this one is also can be found in that form that I mentioned a while ago. This is where we're going to document when we are doing the spontaneous breathing trial test, which we have to meet the 30 to 120 minutes maximum. So the other criteria are the following. The patient should have an effective cough, and the patient should have a good gag reflex as well. So why we have to have a good cough and good gag reflex? Because this one is their airway protection. When the patient is on the spontaneous breathing already, so we can prevent from having aspiration. The next one is that the patient should have low or stop sedation. So usually the sedations are the fentanyl, midazolam. So it should be stopped or as much as possible on low dose already. So the GCS should be 8 or greater than 8 or 10. Then the cuff length should be positive, and the temperature should be less than 38. And then the last one is the causative condition resolved or under control. This one will answer the why the patient was intubated. So if the reason why the patient was extubated is already resolved or already under control, so maybe we can consider the patient to be extubated. So at the end of the criteria for extubation, still it's the discretion of the doctor when or when not to extubate the patient. But if we nurses are mindful of those criteria that I mentioned, so maybe we can recommend to the doctor. So that would be all for this video. Thank you for listening.